Hello, Tennessee Voices viewers and listeners. This is David Plazas, the Opinion and Engagement Director for the USA Today Network Tennessee and the Tennessean. Today, I have the pleasure of having a conversation with the Tennessee Men's Health Network, Michael Leventhal, who's the Executive Director, and Dr. Sal Giorgianni, who is the Senior Science Advisor. Dr. Sal, I hope I pronounced that correctly.
You did it fantastic. Thanks so much.
Well, thank you. I'll keep with Dr. Sal from now on, just to not get myself in trouble.
Sure.
But we're recording this conversation on June 29th, and we're coming near the end of Men's Health Month, and wanted to discuss with you a little bit about what this means and what are some of the issues that you tend to discuss. And obviously it's at an interesting time that we're having this discussion just a few days after a major Supreme Court ruling on healthcare issues, but that may or may not be part of this discussion. But we want to start with the two of you, just if you would introduce yourselves and talk a little bit about the work that you do.
Well, I'm Senior Science Advisor for the Men's Health Network and Dr. Sal Giorgianni. I'm also former chair. I'm one of the co-founders of the American Public Health Association section on men's health, the caucus on men's health. And I've been working as an advocate for men's health, the organization www.menshealthnetwork.org for, I'd say, maybe 15 years or so now. And I've been doing a lot in the area of COVID, because one of the things that folks don't generally realize, David, is that while the percentage of men and women who get COVID is about equal, the percentage of men who die from COVID is a little bit higher. It's about, and that's not just in the US, that's almost globally. So about 56%, depending on where you are in timelines, the deaths from COVID are associated with men. So that, I think, drives some of the important notions that we have and we'd like to share about COVID. Let me turn it over to Mike so he can introduce himself as well.
Thank you, Dr. Sal. I'm Mike Leventhal, and I am the Executive Director for Tennessee Men's Health Network, which is the official state chapter of Men's Health Network, which is a national nonprofit organization whose mission is to reach men and their families where they live, work, play, and pray. And I've been in this role for 19 years. We have a presence in all of Tennessee's 95 counties, and it's a pleasure to be on this podcast.
Well, thank you so much for the two of you. And I've read a lot of stats over the last few years regarding men's health and fatality rates, especially when it comes to issues like heart disease and when it's come to issues such as suicide and drug overdoses, which is certainly a huge issue in Tennessee. And I'm wondering if you could talk a little about the landscape when it comes to the state of men's health and some of the things that you talk about within your own organization.
You know, it's unfortunate that over the past several decades, men have lived sicker and died earlier than they need to, mostly from preventable or at least manageable medical conditions such as cancer and heart conditions, as well as suicide and homicide. It's a terrible tragedy. A lot of it is preventable. When you look at the 10 leading causes of death in the U.S., men lead in 9 of them. And that really is a stunning statistic when you think about it as well. So and Tennessee is really very much at the forefront of bringing the awareness of the status of men to the forefront, because every year for, I think, since 2008 or so, they have published a men's health report card, which is a collaborative effort, including Men's Health Network as one of the collaborators. I was there when I was teaching at Belmont University as part of the first one of these reports. But that really highlights some of the significant demographic issues associated with men and boys' health in Tennessee. So there is a concerted effort there to raise awareness, but it may not be getting to the men in the state.
Yeah, and it's always been our goal to try to change the culture of men's health here in Tennessee. And we do that by starting with young men and boys. You know, so many of our boys play sports and they're taught, like I was when I got hit in a football game, hey, get back in there, you know, rub some dirt on it, shake it off. And that translates later in life to where you may have a little stinger in your chest, or you may not be feeling so good. And you just kind of had this mentality of, I should shake it off. I don't have time to go to the doctor. I'll be just fine. And that's not the type of attitude we need to be having as men. We really need to take a time out. And if we're not feeling well, take advantage of our healthcare system and go see the doctor, especially when it comes to mental health and behavioral health.
One of
I was
the
about to
issues,
bring that up with the issue of mental health itself. No, go ahead, Dr. Sal.
I was going to say, one of the issues tagging onto that important comments by Mike is the fact that we've looked at some of the reasons men don't go and engage in healthcare. And it's, as he said rightfully, the acculturation for men. Also, the media plays a role. When you look at the amount of health-oriented advertising, most of it is oriented to women and girls. There's very little that's oriented to men and boys. When I did a study when I was at Belmont, about 75% of print advertising on health messages is geared to women and girls, and there's maybe 10 or 12% that's neutral, and the remaining few percent is geared towards boys and men. So there's that component. The other is men generally don't feel the healthcare system is welcoming to them. And that's one of the things that we're trying to change, one of the cultural changes we're trying to make in healthcare across the board. You know, a staggering statistic here is, I think, 77% of men, and this was a study done at Cleveland Clinic, 77% of men would rather clean the bathroom or mow the lawn than go to a medical visit. The vast majority of men put off going to the doctor, even under normal circumstances in the pre-COVID world, put off going to the doctor for a medical visit for any condition very much later than women do. Even for painful conditions, they wait until it's almost unbearable pain before they'll go in. So we need to also not just address the view of men's health, the attitudes of men about health, but also how the healthcare system approaches men. They don't do it in a very guy-friendly way.
When you say guy-friendly way, what does that mean?
Well, for example, when I trained back in the 80s in New York, 70s and 80s in New York, OBGYNs made a decided mission to look at the whole patient, the whole female patient, and then provide some triage and primary care services for women early on during their GYN visits. There is no health specialty that does that for guys. When you go into a typical medical office, men feel, and this is what they tell us, so it's an impediment. It's not geared towards them, toward the comfort. Everything from the decor to the pictures to the information that they pick up or the magazines they read. When you look at the brochures and information that men get on health, maybe coming from a physician's office or other places, much of it uses imagery of women. Guys can't relate to that. We did a panel of autoimmune patients who said that I was looking for a peer support group to help me cope with my autoimmune condition. And everywhere I went, it was all mostly women. All the three groups in my area, they were mostly women. I just couldn't relate to that. The other is just how men like to be talked with about health. They like to feel engaged in the conversation. One of the objections men have is they feel the healthcare system as it's set up now disempowers them. They don't have a good vocabulary to talk about health issues, particularly mental health issues, where women have a good vocabulary. A lot of the screening tools that are used to screen for mental health issues are very much more geared towards the terms women would use or the emotional symptomatology that women would express. Very little of it is done with guys in mind. So you can go up and down a long list of things that can be done to make environments in the office, materials that are given out, programs that are used to bring men in to healthcare. Even when you're talking about COVID and COVID vaccines, most of the information is geared towards women. Most of the imagery is geared towards women. And that goes back to the fallacious comment that healthcare is a women's issue, not a guy's issue.
One of the things I'd love to talk to you about is some of the COVID-related issues that I've read about regarding health in general, but also specific to men, and that is the issue of the rising cases of alcohol consumption and substances consumption, the nutritional issues, so the rise toward obesity or being overweight, and then finally, perhaps separate from that, I'd love to talk to you a little bit about some of the research I've done with young men and body image when it comes to media such as Instagram or others. But Why don't we start with some of the COVID-related issues and how you're addressing those specific things in terms of trying to, help men who have gained weight or perhaps drinking too much. And these are conversations that I've had with both medical professionals as well as community members.
Yeah, maybe if I could give you a little bit of a background painting, and Mike can weigh in on some of the very important projects that our Men's Health Network is spearheading in Tennessee now. Because men have many comorbidities that we believe that they are set up for more serious infections and more of a setup for, unfortunately, mortality associated with COVID. Also, the isolation, the inability to work, they affect society overall, no matter what gender, what kind of work you do. It's been very difficult for so many people. We are seeing an overall increase in both alcohol consumption, substance abuse, and the number of deaths associated with substance abuse in the U.S. It's raising to tremendous proportions that we've never seen before. CDC has recognized this as a burgeoning public health emergency. And a lot of it is because of the impact that COVID has had on the psychology of individuals, the isolation. So even when you look at the social networks that support men, particularly young men, in their health, they all had to be curtailed because of COVID, and they're just now starting to make a comeback. When you look at faith communities, particularly in African-American communities of color, they are extremely important to the overall social context. Many of the faith-based organizations have health related pastors. Those too had to sort of shut down because of COVID, and now they're just getting back into it. So another dimension is that men who normally put off going to the doctor and normally put off getting diagnostic tests basically shut it all down for 2 years. There was no, people just were not able to get medical visits. A lot of quote unquote elective procedures, elective diagnostic testing was curtailed at hospitals. And that, unfortunate, started to build a bad habit about going in for general visits, managing chronic diseases, and very few, and even a decrease in overall vaccination rates. So we're seeing a lot of problems associated with pulling back because of COVID. It's not exclusively with men, but men seem, because of their underlying view that health isn't their thing or their responsibility, are suffering greatly from it.
Thank you very much. Michael, any thoughts on that?
Well, I'm just excited about what we're doing to solve these problems. And one of the programs that we have launched this month, Men's Health Month, is our Certified Men's Health Educator program, where we're working with targeted counties in rural Tennessee, where we will be able to help communicate messages for men and boys to better allow them to have better access to the healthcare system and learn how to talk to these types of providers that they're not used to talking to. For example, a lot of young men don't go to the doctor unless they're getting a sports physical. And after that sports physical, they don't go back to the doctor till they're in their 50s. And so there is a communication lag. And this program, this training, where we will go into these communities and train the trainers, it will give them the tools they need in order to facilitate the messages to boys and men. And hopefully our goal is to get guys to go to the doctor.
The training program Michael is referring to is in part funded through monies from CDC to help address the issues of COVID and vaccines. So there is a specific module on how to talk with men about COVID, how to talk with men about COVID vaccinations and vaccinations in general, how to motivate them, how to present programs in a way that men will go to them. So the overarching theme of the program is twofold. One, to address the issues associated with clarifying some concerns about COVID vaccinations, long COVID and other things, but also how to get guys back into the swing of getting their medical needs met by enhancing the way to talk with men about it in a way that resonates with them and motivates them.
Well, thank you so much. I had brought up also the issue of body image, which often hasn't been associated with mental health issues in men previously, but we're in an age of influencers and social media, be it Instagram or TikTok. And certainly the expectation of what you're supposed to look like or present has been something that is being studied. Is this do you address this, especially with younger men and boys? Is this something that has come up or is something that you have addressed?
Men's Health Network hasn't addressed it per se, but in general, the whole area of nutrition is related to the views men have about what constitutes healthy eating. I am working on a project outside of Men's Health Network in Oklahoma City, which is funded by an organization called PCORI, Patient-Centered Outcome Research Institute. And this study is looking at developing a network of peer support within the African American community in Oklahoma City that will help men understand how to engage in healthy food behaviors in a way that resonates with guys. So, for example, one of the programs is prostates and pancakes. Have a pancake breakfast and talk to guys about their prostate and maybe do a little bit of screening. Health good for you barbecue. How to have barbecue and do it in a way that's healthful. We're looking at other options on how to build a network to reach out to folks to help them get food, to shop healthy, to prepare it healthy, and then to balance their meals and include exercise. So we're working on several fronts. Body image for guys is generally not spoken about, but it is a huge concern, especially when most of the imagery out there shows overly muscularized guys who may look very healthy, but truly inside then may not be particularly healthy. And with the increased use of social media as one of the only ways that young men can interact with others, and the sometimes uncomplimentary comments that people make about individuals on social media can really sting guys. You couple that with the innate inability for guys to express their emotional hurt because they're not taught how to have that kind of vocabulary, is a real powder keg of a problem for many, many young men and older guys too.
Yeah, and David, I'm so glad you brought this up. I've got an 18-year-old daughter, and she said to me the other day, she said, "Dad, do you all do any type of work for young men that have these body image issues and eating disorders?" And I said, "No, we don't, but we'd love to have your input on that." That's coming from the mouths of babes. So she's recognized it at the gym that she belongs to, where she sees a lot of these young men taking supplements and trying to look like that cover model on the cover of Men's Fitness magazine. And we don't really consider that men's health. That's not men's health to us. Men's health doesn't look like the cover model, the fitness cover model on the cover of the magazine.
But typically I do this midway, but we're almost at the conclusion of the conversation, but I want to spend a little bit more time asking you about yourselves as leaders. What are you doing to stay healthy and well during this time? What are you reading, watching, doing for your own self-care?
Well, early on in the pandemic, I must tell you, I started binge watching everything on cable TV, serials and movies, everything from Green Arrow, I can't mention, but everything from serialized action-oriented dramas to even some kid programs, because I found them fascinating to look at. Again, because I look at the way it influences imagery. My wife and I are a little older. I am a firm believer in vaccination. We have been vaccinated, but yet still, even at this stage in the pandemic, because of our underlying health, particularly my wife's, we do go out and we do have a good time. We visit with friends and with relatives or grandkids, but when we're in enclosed environments, we still are cautious. We wear masks, we wash hands, we try to keep distance. We just took a cruise. It was a 30-day cruise. We wore masks everywhere. There were a lot of people who did that. So, at different phases in the pandemic, I and my wife, we have done everything we can to reasonably keep us safe so that we didn't put our lives on hold, because at a certain age, you just don't have that many years left, so to do things. So, but being cautious, staying at home more were the ways that I have coped. And I've read even a few books that I haven't had a chance to read in a long time.
And for better or for worse, I did not trade GameStop or AMC stock or Bitcoin. I did do some of the traditional things that guys my age are finding themselves getting themselves into. I love music and I love playing guitar, so I worked on some of my guitar skills. And I live in a really an old school urban neighborhood that has greenways connected to nature centers, and I took full advantage of those every day, taking walks and just thanking the Creator for allowing me to be alive, and working on my mental health, because we all did suffer during the height of the pandemic, and some of us suffered a lot more than others, but those of us on this podcast have survived it, and we're here to tell the tale.
Well, thank you very much to my guest, Dr. Sal Giorgianni, and also Michael Leventhal. Dr. Sal is the Senior Science Advisor for the Men's Health Network, and Michael Leventhal is Executive Director for the Tennessee Men's Health Network. Before I let you go, I'd like to ask guests if they would leave us with some words of wisdom to help the audience get through this challenging time. Why don't we start with Michael and conclude with Dr. Sal?
One of my favorite quotes by one of our founding fathers is the one from Benjamin Franklin, where he says, "An ounce of prevention is worth a pound of cure." If those of us had that philosophy, I think we would be in a much healthier state of mind and state of physical being.
I think guys need to take a page out of the women's health playbook, and they have to take personal responsibility for themselves, the health and welfare of their families and loved ones, and they have to become proactive, know how to talk about health and how to advocate for their own health. Women do that very well, and guys need to understand how to do that very well.
Well, thank you both. May you both stay well and healthy. And I'm so grateful that you
Well,
joined me today on the Tennessee Voices video podcast. Have a great day.
Thank you. You as well.